Hello, my name is Dr. Brian Ward. I'm a veterinary surgeon here in the northern Kentucky, Cincinnati area. I am a mobile surgeon, so I go around to different clinics and things. One of my bigger customers is Grady Veterinary Hospital. And so one of the more common things that I see as a surgeon is cranial cruciate ligament disease, or ACL disease. So my goal today is just kind of present the different surgical fixations that I provide or that are commonplace in the veterinary field. So first of all, just kind of a general anatomy lesson. So this is the canine knee. Very similar to human knees, conserved throughout pretty much all species. There are two ligaments in here, the cruciate ligaments. This is the caudal cruciate, this is the cranial cruciate ligament. Their purpose essentially is to hold the knee together when we go to take a step. If for some reason the cranial cruciate ligament was torn, when we go to take a step, the actual knee luxates or moves back and forth. And so where we find issues with this is the cartilage can get beaten up. We can develop a bunch of arthritis, chronic pain, thickening in the joint, and things like that if we don't intervene surgically. And so that is what my goal to talk to you today. We essentially have three surgical options. One is called a lateral suture, one is a TPLO, and one is a TTA. Now, again, these procedures, their goal is to stabilize the knee, because right now it has a biomechanical issue where its tether is broken. And the source of the motion of the knee is actually the slope here. In a normal dog, it's around 25 degrees. So when the dog goes to take a step, the rounded femur hits the top of the tibia, and it wants to slide downhill. And so there's a net motion at this point with a tibial thrust. So these procedures, again, are aimed to mitigate this force. And so with the lateral suture, what we do, we actually have a little bone called the fibella and the fibular ligament behind here. So you actually put a big, thick piece of nylon behind that through the tibia, and we have a figure of 8, which we tighten down and it holds the two bones together. And so what this does is it actually holds the knee in place where a bunch of scar tissue can be laid down to reinforce the nylon. And essentially this has been around for the longest time. Millions of dogs have had it, and many have do well. The problem with it is, again, we need this scar tissue before this nylon stretches or breaks, and then if that happens, then we lose and we have to repeat the procedure. So as you can imagine, larger dogs, probably anything greater than 50 pounds, there is a propensity to tear this nylon. And so probably, let's say 20% or so greater than 50 pounds will tear this before it's actually healed. And if that happens, you have to repeat the procedure. And so, if you've got a Yorkie or a small Beagle or something, the lateral suture is absolutely fine. If you're talking about a Mastiff or a Great Dane, it's probably not the best choice for you. But the other procedures, the TPO, the TTA, both these have a substantially greater success rate, with 95% good to excellent outcomes. With the TPLO, we again pay attention to our 25-degree slope here. And what we do is we actually cut the bone in a semicircle and we rotate it around, and we put a big bone plate on there. Now, what that does is, essentially, the way it was described in the 80s was it gives us a flat place to land when the femur does land. So now, instead of landing and sliding downhill, it lands on a flat surface each and every time, and gives us a stable stifle when we're walking. It's a little bit different story when we're sitting, laying down, things like that. There's still some motion there. But this far and above is, to me, the best procedure we have. And again, versus, depending on Mother Nature, like with the scar tissue, we're actually taking measurements, turning the bone exactly the right amount in order to get the outcome we want during the procedure. So much more predictable outcomes. Now, again, this is the way it is described, is when you give a flat surface here, it gets rid of this force. But what they actually found out through some biomechanical studies was, as long as you get the top of the tibia perpendicular to the patella ligament, it gets rid of this force. So that is kind of the premise for the TTA. Where we end up cutting the bone here, move this forward, which moves this ligament out. again, making the top of the tibia perpendicular to the ligament and getting rid of this force. Now this has got a cage and a small plate here to support the bone. So in a nutshell, the TTA and the TPLO, you cut bone, move it around to construct a knee that does not need a cruciate ligament anymore. The nylon is a good procedure for small dogs as a prosthetic ligament repair. This is more aimed at larger dogs with good success. As far as functionality, they all end up being about the same functionality as long as you get them healed and everything goes appropriately. This is an overview of the 3 most common techniques for repairing craniocruciate ligament disease in the dog.